Welcome to Larry King Live.
The final days of a person's life can be filled with physical pain, sometimes too much to bear. That, of course, has prompted Dr. Jack Kevorkian to assist some patients in committing suicide. But have any of these people died needlessly or erroneously? To discuss this issue on the eve of Dr. Kevorkian's latest trial, his attorney, Jeffrey Fieger. He joins us from Detroit. Here in Washington, Dr. Pawan Grover of Memorial Southwest Hospital of Houston, where he runs the Advanced Pain Management Center. He says many doctors simply aren't keeping up with new kinds of pain treatments.
I'm not suggesting that in all cases it works. What I'm suggesting, one thing is that for the public information, Dr. Kevorkian is a pathologist. And with respect to pathology, they do not deal with clinical patients. He does not have the medical knowledge to assess these patients.
Let's hear from Gene Frederick now, who joins us on the telephone from Houston. He's a cancer patient. He's being treated for pain by Dr. Grover. Mr. Frederick, it's your belief that had your pain not been treated, you would have reached for the gun?
Yes, sir, I would have.
Tell us about that.
Well, the pain was so excruciating that I couldn't stand to have anyone walk in the room with me, much less touch me.
Were you actively considering or contemplating suicide?
I certainly was, yes, sir.
In what way? Had you contacted Dr. Kevorkian?
No, I was going to do it myself.
And then what happened? How did the pain treatment affect you?
Well, it might be a long story. I'd asked for the means to do it by, and the wife, rather than taking my thoughts on the matter, said she could find something different, and she contacted the pain management group, which happened to be Dr. Grover's.
Mr. Fieger, if I may come out to you again, Mr. Frederick's experience here with this very, very intense pain, such that it induced him to think about taking his own life. What is to say that none of Dr. Kevorkian's patients would have had a change of heart similar to Mr. Frederick had their pain been controlled? And how can you assure, and Dr. Kevorkian assure the public, that in fact every possible means was taken to do that?
CNN, America's campaign headquarters.
Hi, Lorna, how are you?
His patient, Lorna Harrison's car was hit by an 18-wheeler and left her in excruciating pain. Doctor after doctor couldn't help her.
In January, did a procedure, a surgical procedure, and completely removed every single ounce of pain that had ruined my life for 3 years.
11-year-old Joe Patterson is hard at work.
You want something to drink?
Eager to help his mom, who needs it.
Help my mom get through this surgery.
It's a sharp, throbbing pain.
For 2 years, Gracie Patterson's back pain has been debilitating.
There's sometimes in the morning that I can't even get out of bed.
She's had 7 foster children, but no more. And traditional back surgery is not an option.
It takes 6 to 8 months of recovery. And I can't do that because I have a special needs child.
Like millions of Americans, Gracie's spinal nerves have gotten squeezed, causing pain. To relieve pressure, surgeons traditionally carve out some bone, but that weakens the spine. Now, Dr. Pawan Grover is using a new procedure which changes that. A series of needles and live x-rays help map the target area and the nerve area.
A needle so we can put dye, what's called a...
Then through a tiny incision, a metal tube is aligned and instruments begin shaving a little bone, but mostly enlarged ligament.
And we'll do it in bites to free up that ligament.
So this is sort of a before and midpoint during the procedure. The dye here won't go through, showing how completely compressed that nerve is in this white area. Halfway through, the dye already shows a dramatic improvement where the pressure is being released on the nerve.
She's like this.
At home, Joe is waiting to help the mom, who has always helped him.
It's because I'm adopted.
Now they are sharing another chapter of their lives.
It's just second chance.
A few weeks ago, we visited with a local mom suffering from a debilitating back problem. 1.5 million Americans are diagnosed with the same spinal problem each year, but she became one of the first Houstonians to try a new procedure that reportedly cost half of what you'd pay for traditional back surgery. Recovery time is also reduced from months to days. Sounds great, but does it really work? 11 reporter Sharon Min Chow went back to find out.
Like this and just had to jump. Like she just pushes herself up, like struggling really hard.
Joe Patterson's mom literally had to crawl up the stairs, and that was before her back pain got really bad.
We had to close the upstairs down.
I could see her struggling, and I hate that.
It's breakthrough stuff. And I believe it's going to change the way that we treat this condition.
Ask Gracie, who days later was walking unassisted to check her mail.
And, I'm able to do things around the house that I hadn't done in 2 years.
Gone are the cane and the daily medicines.
No patches, no anti-inflammatories, no pain pills, and no muscle relaxers. I have a brand new life now. There is absolutely no pain.
She is even doing stairs again.
My husband has me back. My son has me back.
Small steps that have a huge impact.
As efforts to get Hurricane Katrina evacuees back to their homes in the Gulf begin, health hazards threaten those who return. Even as floodwaters in New Orleans recede, bacteria from that filthy, stagnant water could be carried by mosquitoes, bringing new disease. Joining us now from Houston to talk about this, Dr. Pavan Grover. He is a volunteer in the triage unit at the Astrodome. Boy, you must have seen a whole world of medical situations there. I will try to cover that another time, but there seems to be dispute over whether people can really get diseases like cholera, typhoid fever, and waterborne illnesses. Doctor, what do you say?
Well, Bridget, there's always that concern, especially in this kind of environment that we've created. Now, there have been a few cases of something like cholera, but it's not really kind of full-blown yet. So I think the CDC has to monitor those kind of things. I mean, a real kind of concern should be things like West Nile virus, because you have stagnant water, and we're in the peak season of that kind of mosquito.
Well, you might remember about a month ago, a widely hyped study from the CDC that said if you're overweight, you're not at greater risk of dying than people of normal weight.
And I remember this, Dr. G, because you said that was wrong, and guess what? Now the government is agreeing with you. So let's take another look at what you said.
It's definitely hype.